Okay, now the South African Medical Research Council is concerned about an increase of the coronavirus in wastewater in Cape Town and other parts of the Western Cape. SARS-CoV-2 RNA is a strain of the coronavirus that causes COVID-19. Now, the Wastewater Surveillance and Research Program of the Research Council says the past week has seen sharp increases. Now, the Council operates a surveillance program in more than 80 wastewater treatment plants across 6 provinces. Professor Angela Mathee is a member of the Council's Wastewater Surveillance team, joining us now via Zoom from Cape Town. Good afternoon, Prof. Welcome to Today on eNCA. Now, what concerns you about this finding that you are making, and how sharp is the increase?
Well, after months of relative calm, we've suddenly started seeing sharp increases in the concentration of SARS-CoV-2. Initially in Cape Town last week, there was a really sharp increase in the concentrations in almost all of Cape Town's wastewater treatment plants. And the levels were of the same concentration that we saw in waves 4 and 5, hence us issuing that alert to the public. So that was last week's results. And this week we were very pleased. Last night, actually, we got new results, and we've seen that many of those concentrations have either tapered off or they've come down a little bit in Cape Town.
So then
what we
yeah, so just to cut in there, you're saying the latest information from last night is that there is a tapering down somehow of the traces of the coronavirus in the wastewater.
Yeah. That's right. But instead, we are seeing in some other places, like in Nkoa in the Limpopo province, there's been a very steep rise in the concentration, and in Nelson Mandela Bay, we are also seeing about half of the wastewater treatment plants there, that there's been, for 3 weeks now, there's been a week-on-week increase in the SARS-CoV-2 concentration.
And that's in Limpopo?
There's definitely something going on in Limpopo for Nkoa, and then in Nelson Mandela Bay, half of the wastewater treatment plants, we're seeing over 3 weeks, a rise every week.
Okay, so the increase, sorry ma'am to cut in there, just for explanation, sorry, pardon me, the increase you've noticed in the wastewater of COVID-2, or the strain, SARS-CoV-2 RNA in Western Cape, is now also being seen elsewhere in the Eastern Cape and in Limpopo.
Yes, so in Cape Town there was a sharp rise, and then we've seen a leveling off and a decline, so we really have to watch those concentrations next week. And this week we've seen this sharp increase in Nkoa in Limpopo, and we're seeing this more moderate but steady increase over 3 weeks in half of the wastewater treatment plants in Nelson Mandela Bay.
Okay, what about the results from the other 3 provinces? Because we've mentioned the Western Cape, which was last week. Now you're seeing Limpopo as well. Things are the numbers, what you're finding, the traces are going up, and there's a moderate spike in Nelson Mandela Bay in the Eastern Cape. What about the other 3 provinces?
So in the Eastern Cape, we also look at Buffalo City, and there we're seeing also a sharp increase in one of the wastewater treatment plants. In Gauteng, we look at Tshwane, and there we're not seeing much of an increase. And for the Free State, we don't yet have those results in. They're still going through quality control checks.
Okay.
But we are a little concerned.
Sorry, ma'am. KZN, KwaZulu-Natal, are you not monitoring that in Northern Cape? If not, why?
We do monitor the north of KZN, Umhlathuze, and there we're not seeing very sharp increases. Okay. And we don't monitor the Northern Cape at the moment.
Okay. Well, by now, many people are thinking COVID-19 is done and dusted, it's gone, it's forgotten, it's historic. Why should we be worried about what you've been noticing in the wastewaters that you've been monitoring in the different parts of the country, as you've just explained?
So combined with the increases that we're seeing in the wastewater, the NICD is also picking up an increase in the proportion of positive cases or positive tests And there's also, in Cape Town, for example, been an increase in the cases of COVID-19 being reported to the NICD. So there's definitely something going on. There's something at play. We don't know yet about hospitals, whether there's an increase in hospital admissions. We also don't know if there's an increase in ICU admissions. So it's possible that many of the cases are mild or they're asymptomatic, but we do know from our wastewater results, we're confident that there are many more people right now who have active COVID-19 cases, but they're possibly asymptomatic or mild.
Okay, so you're going to be continuing to monitor the situation, and now as these results come through, as you test, you're sharing them with the scientists like the NICD, so that that link can be better understood between cases that are COVID-19 positive and people who might be hospitalized, and then generally whether mild or not. I mean, are you collaborating very well there?
Yes, every Monday we go to all those 80+ wastewater treatment plants. Then on Monday afternoons and Tuesdays and Wednesdays, we do the analyses, we do the quality control checks, and by Wednesday evening, the team meets to discuss and interpret the results, and then they get distributed to all the affected municipalities, as well as to provincial and national stakeholders. And then we also post the results on the MRC's dedicated dashboard. So anyone can go to the MRC's website and click on the wastewater icon, and it'll take you to the results, and there are various ways that you can view the findings.
Okay, finally, I mean, by the time you trace or you find coronavirus, COVID-2, in the water, as you say, in the wastewaters, it means it's already being taken out of the system from a human being, which means it's present. As you say, we might be having many of us being asymptomatic or mild, or we don't know, but so far it looks like there's no serious cases. What would your advice be over the next few weeks? What must we do? Because for as long as you continue finding traces of coronavirus in the wastewater, it means it's still very much active amongst us. What would you advise us to do?
Personally, I'm advising my friends and my family to, over the next few weeks, to just take a precautionary approach, and to, especially if you're a high-risk individual, so you have pre-existing ill health conditions, or you find yourself in a high-risk location at the moment, then to just adopt those simple, tried and tested measures that we were so used to before, to wear a mask, especially if you are in a crowded indoor space, to be careful about your hand hygiene, and to make sure that you're up to date with your vaccinations or your boosters.
Thank you very much for that very good advice there. That's Professor Angela Mathee from the Medical Research Council. Well, there you've heard it. There is a spike, an increase in the traces of coronavirus COVID-2, that's SARS-CoV-2 RNA, in wastewaters in the Western Cape, and it's sort of declining a little bit now, but there is one as well in the Nelson Mandela Bay and Buffalo City in the Eastern Cape, and also in the Nkuankua area of Limpopo. So please do take heed of that advice. There may not be many cases that we know about in hospitals, but coronavirus is still very much with us.